Welcome back to Stop Feeling Like Shit. Today we're talking about a critical but often overlooked part of training, connective tissue, with John Quint, a leading expert in movement, rehabilitation, and performance. Most people focus on training their muscles, but what about the connective tissue that holds it together? Understanding how ligaments, tendons, and joint capsules function can dramatically improve performance, mobility, and injury prevention. If you're serious about longevity, performance, and pain-free movement, this is an episode that you don't want to miss. And I'm excited about this one because I don't stretch, I just train, and I need to know the good, the bad, and the ugly. So give it to us.
Okay, yeah, that's a very impressive introduction.
Thanks. I came up with that.
That's okay. And so it's kind of funny, like connective tissue isn't something that a lot of people talk about, right? I think most people talk about it, or at least the conversations that I have is like when somebody's injured.
Mm-hmm.
It's very much like an afterthought. And you know, my background, like your background, right? Like because we went to the same college, right? Like I remember like back then, you know, reading like Super Training, which is a book written by Mel Siff, right? Everybody's kind of heard of Mel Siff, even though he's passed away. And you know, I remember reading it, and they're talking about like, hey, connective tissue isn't this trainable thing. Right. It just kind of like stuck out. And I'm like, really? You know what I mean? Like, and I didn't know enough at the time, but I'm like, that's kind of crazy. So like the muscle's trainable, the nervous system's trainable, but connective tissue isn't trainable.
Part that the muscle exerts force through isn't trainable, which is a crazy notion, right?
For sure. So like, you know, you kind of know enough that it's like, it doesn't pass like the smell test. Mm-hmm. And so, you know, fast forward, you know, I did a lot of work with Louis Simmons at Westside Barbell, and we just didn't deal with connective tissue injuries. And the reason why is because, you know, at one point in powerlifting, the sport of powerlifting, they started to use gear.
Yeah.
And, right. Like you guys are obviously with the
there was no gearless back for a while. There was no gearless, was there? Everyone was gear.
Yeah, no gear. And then, you know, if you talk to Louis Simmons, he was all about absolute strength, like the absolute amount that could be lifted. So that's why he adopted gear, because connective tissue was a limiting constraint on that.
Yep.
So he would run into the nervous system scaling up so much, boom, connective tissue injury. So what do? You just put gear on it.
Put briefs on, and you put deadlift suits and things like that essentially would compensate for connective tissue. Is that correct?
Okay, gear is in like things that you put on yourself.
Yeah, not
I'm thinking
gear.
of gear, like steroids.
There
okay,
may be gear
got
too,
it.
but we're talking different gear.
I'm like, okay.
Yeah.
But
Got
some
it.
of those suits are crazy. Like the guys, I've been to meets where a guy can't get his gear off, and their legs would be purple, and they'd start freaking out, like because it's so tight that literally you can't move.
Or you
right?
see some of those bench shirts where guys were like, literally, if I don't have 500 pounds on my hand, I couldn't visibly get a bar to my chest if my life depended on it, because it's so tensile, right?
Yeah. Okay.
For sure. So like at Westside, I just never dealt with connective tissue injuries.
Mm-hmm.
It wasn't something that I really saw,
Mm-hmm.
right? Like I saw a lot of joint issues. I saw there's a lot of specific injuries that I saw that, you know, we essentially developed strategies to kind of, you know, starve off like joint specific accommodation to lifts and stuff like that was kind of like the realm that I functioned in.
Mm-hmm.
And then, you know, what ended up happening is, you know, as I started to get out and work with like different people, you know, different sports that, you know, and when I'm saying this, like I'm not talking shit about powerlifters, right? But you know, there's not a lot of movement in the sport.
Mm-hmm.
Funny story.
Sure.
We're good friends with Chuck Vogelpool, and we went on vacation with him last year. Before he was going to the gym, he was literally using duct tape. He was duct taping his joints.
Yeah, that's what
like literally silver duct tape. Like before his workout, what the hell are you doing? Is just to protect the joint.
Yeah. So listen, that's the logic. So you see how that logic, like that's the gear, and now it's like, well, now it's like I don't have a suit for this per se, so I'll just start to use duct tape, which is like a real thing, right?
Yep.
Like
it worked for him, I guess. I don't know.
yeah, for sure, right?
I mean,
and so
it works until it doesn't. Yeah.
Yeah, and so you can see like they were able to figure out how to get around those limiting constraints of connective tissue by using gear, right? But he couldn't starve off the joint-specific accommodation in the spine.
Right.
You see that, unfortunately, with like that era of lifter in like the 90s, like before geared lifting came about. And then when geared lifting came about, it's like, well, the nervous system doesn't know that can't delineate the difference between like this is like external tissue and internal tissue. And that's how they can start to scale up. And to your point, one of my good friends, his name's Taylor Stillpass. He's got a facility in West Virginia called Power Up,
Okay.
and I'm good friends with him. I've treated him for a long time, and he sends me a text, and he's like, "Hey, you know this Jimmy Kolb guy?" And I'm like, "No, I have no idea who this guy is," because people kind of conflate like my background was in bodybuilding, so like I'd never I did one I did one bench press meet, but like I'm not really that big of a fan. Like I support everybody that does it, but it's
Right.
not like on the weekend, like, hey, like you guys want to go check out this powerlifting meet.
Right.
Yeah.
So I just kind of hear about it, say like, oh, how did this person do?
Yeah.
And they're like, hey, there's this Jimmy Kolb guy. Have you heard of him? I go, no. He goes, dude, this guy's getting ready to bench press 1,400 pounds. And I'm like, what?
1,400 pounds.
I'm like, dude, are you kidding me? Right. So to your point, like the gear has went exponential, which is really cool because we can see how much the central nervous system can scale up.
Mhm.
Right. So it really, to me, it's kind of like, it's really cool because you're like, well, like the nervous system pretty much has almost unlimited potential if you keep giving it what it needs to transmit force, as you're saying.
Yep.
Right. So it's really cool to see that. And I love those extreme sports. Right.
Yeah.
But essentially sorry, I'm kind of going on a tangent, but essentially, so once I left West Side, I started working with more like, let's say NHL guys and NFL guys. And, you can't put gear on.
They don't have gear like that. Yeah.
Yeah. Yeah. You can't put gear on an adductor longus tendon.
Right.
Like you have to build an adductor longus tendon. Does it make sense?
Yep.
Yeah.
So now it's like a new set of problems that you have to solve.
Mhm.
Right. And so, I was fortunate enough that, in working with like FRS, which is Functional Range Systems, Dr. Spina, Dr. Shivers, that, we were kind of already going down that route because we were looking at joints as trainable things because we could see that they were treatable
Mhm.
because like that's what I was really seeing when I was at Westside. It's like, okay, well, your lift's going up, but your fundamental joint range of motion is going down.
Right.
Right. And so like this is an inverse relationship that's saying something bad is going to happen. Like
Right.
your joints accommodating to training. And that's why you see, unfortunately, during that era of Westside, if you look at those guys, I'm friends with a lot of them and I know a lot of them. A lot of them have total joint replacement.
Yep.
Mm-hmm.
Right. So it's like the nervous system scaled up so much that it degenerated the joint.
Say it was an adaptation to get better at the lift, but a maladaptation to the rest of life.
100%.
Yeah.
Yep.
Mm-hmm.
100% accurate. Right. And that's the cost of high performance.
Mhm.
Right. People conflate high performance with health, and the two are completely different. And when you
Yep.
skew towards performance and you start to augment performance, there's going to be health costs to that.
Yep.
Like anybody that looks at a retired NFL athlete can see that there's cost to being able to perform at that level.
Mm-hmm. Yeah.
So then we started going down the route. It's like, is connective tissue trainable? Like it's treatable? Like that's what soft tissue treatment, right? And so then that's when we kind of went down that rabbit hole of like, well, yeah, it's trainable. And so then you start to systemize. Well, like how do you train it, and what do you train it for, right? And it kind of opens up an entire new realm of what we can influence with work. Let's say.
Yep.
Okay.
So,
So-
FRS stands for Functional Range Systems.
Yeah.
So functional range systems. And so the component, everybody comes in through functional range systems through functional range conditioning, which, and then there's other, there's assessment, there's all these different courses. But then when you're talking about like the performance side and like augmenting very specific neurological and tissue specific behaviors, that's going to essentially live in like the internal strength model.
Okay. And just for the spectators or people listening, so then basically this is joint specific training. So not muscle training, this is joint training.
Yeah.
But if you look at people's age, people usually don't have muscle problems, they have joint problems. But no one trains their joints.
Correct.
This is where this comes in.
Correct. So you don't. So yeah. So like when you're working with someone, right, and you start to ask them, like when you guys intake a patient, right, and you're like, well, what do you guys do? It's like we kind of do the same thing. It's like, well, what are you doing for your joints? And they're like, well, I don't know. And so to get back to the original question,
Well, a lot of people say, well, I stretch.
yeah,
I stretch. But stretching is not functional. It's not the same
It's
thing.
not a function of the joint.
correct. Yeah, because like the joint, when you think of like the anatomy of the joint, think about it very simply of just two bones that articulate with each other, right?
Mhm.
well, that joint is encapsulated in connective tissue, which is the capsule, right?
Okay, yeah, I was gonna say, what's connective tissue? What is it?
Yeah, so connective tissue depends on what lens we're looking at it, right? So, like, if we're looking at it from strength output, it's the tissue that enables force transmission to occur.
Mhm.
So, like, you have a nervous system, and then the nervous system like interfaces and tells the red muscle tissue to contract. And then when that tissue contracts, it pulls on, like, let's say this fabric that's connective tissue. And if that connective tissue has the load bearing capacity, then it can transmit that force. But if the nervous system and the muscle tissue output too much force, right? If there's an asymmetry in what the muscle and the neuromuscular system can output, then the connective tissue will yield.
Mm-hmm.
And so when you look
Yield
at
means tear.
yield, yeah, for sure.
Yeah.
So like grade 1, grade 2, right? And so this is kind of the rabbit hole that I've been selected. I'll say from a business standpoint to go down because you'll have athletes that have very specific injuries, like let's say to a tendon, so where it goes from like red tissue to white tissue to then bone, right? Like that let's say that musculotendinous junction where it's kind of like the red tissue is transitioning into white tissue to.
Is that where the injuries usually occur? Or where does the injury usually occur?
It depends, but yeah, I mean, a lot of injuries occur there because that's kind of like the intersection between the two different tissue ecologies of white connective tissue and red muscle tissue.
Mm-hmm.
And if the athlete's nervous system is too scaled up, or if there's other things that they're not doing to maintain the tissue, if they're, there's all sorts of factors that play into it. Like if you're in the cold, you're dehydrated, if you're in the NHL and you're on a road trip and this is the third game, right? There's all these factors that are going
Or if you have cortisone injections, you have joint pain, so you get a cortisone injection, which weakens the white tissue. Or weakens all the tissue, really.
100%. And then you have that aspect of it, right? Where then you have a doctor that's maybe prescribing things that are going to help with symptomology of an underlying connective tissue issue that maybe now that athlete is their nervous system is going to feel good. So then they can output and then boom, now we have this injury, right?
What percent of the injuries, because you treat a lot of athletes with injuries, what percent of those people have taken either cortisone, NSAIDs, something that causes, that weakens that tissue? What percent would you say?
I mean, unfortunately, I would say like, 90%, right? Because that's kind of the conventional route that's just the conventional, like, that's the
route of intervention because it'll return you to play in 24 hours. But
because at the end of the day, if you have pain, you have inflammation, that means there's some problem between either in the connective tissue, in the muscle, or both. So typical medicine will give you a medication to numb that signal.
Correct.
So it's kind of like your check engine light comes on in your car and you gotta go drag racing or something. Yeah,
yeah,
I mean,
right. That's 100%. That's 100% true, right? Because once again, I think it goes back to like the original thing that like you're bringing up, where it's like, oh, connective tissue is trainable. Like I didn't know that. So when you're talking directly with the athlete, they're like, oh, like wait, they're like, I can train this thing. I didn't know that, right? And that's kind of where this conversation starts. It's not like people don't reach out and go like, hey, I'd love to talk about connective tissue training.
Well, and it's interesting from my background. As John mentioned, he and I went to the same college, actually had the same advisor, had the same degree. I was actually telling them like, yeah, John and I went through the same program with the same advisor in the same school, which is a small school, didn't know each other in college.
That's weird.
But then worked together for the better part of a decade.
Yeah.
But for people that don't know me, like my undergrad is basically an ex-phys, and I have my CSCS licensure for collegiate strength and conditioning. I didn't know connective tissue training was or connective tissue could be trained and you could train to make accommodations with that until I met John working at the last office we worked together, right?
Mm-hmm.
And also I had a tremendous amount, I had a tremendous amount of injuries, and if I misspeak, John, please correct me. John's talking about muscle tissue's force production capacity in the nervous system. So you take the quadricep, for example. Let's say I was extremely strong through high school and college, but let's say I have a quad and a nervous system that's capable of exerting a tremendous amount of force and extremely rapid and powerful contraction, but a absolute dog shit patella tendon. Well, that patellar tendon is really what's exhibiting is what's actually transmitting force to the bone. So it doesn't matter how good my nervous system is, it doesn't matter how strong my quad is, if that tendinous structure is garbage and that's what's actually facilitating movement, there's my rate limiting factor. And one of the things that's going to happen, it's either going to be a limitation in performance or that tissue is going to fail when I load it in a manner that it's not used to being loaded in, right?
Mhm.
So would
Okay.
you say that's inaccurate? Was that an accurate description?
Yeah, it was a little better than anything I could say, right? Yeah, for sure. Like that's 100% it, right? And that's kind of the problem, right? Like is to your point, right? Like these things present with symptoms.
Mm-hmm.
Usually, people that have issues, either sports or working out, it's always the connective tissue. Like
100%.
yeah.
Like
So when that happens, people usually would, like the most common is cortisone shot, a corticosteroid shot, right?
for
So
sure.
you go to your doctor, hey, you have some inflammation, put some corticosteroid in there. But the problem with that is that it weakens the tendon even more so. It might
Right.
get rid of the signaling,
Correct.
but that's the worst thing you could do because you still have this muscle, this strong nervous system that can handle the capacity. But now you're only as strong as your weakest link. You've even weakened that more.
And John, would you argue that when you do that and you remove the nervous system's mechanism of inhibition that's protective in nature by knocking down inflammation, you've actually made it worse? You've weakened the tissue, and then you've actually made the body even more inclined to put excessive force through that tissue because it basically doesn't know there's something wrong, even though there is.
Correct.
Okay.
100%. Another thing that you have to think about too, right? Like that's what starts to change. Like in powerlifting, everything's controlled. So like the movement, like the bar path, like everything's controlled, right? When you start to get to, it's funny. That's one of the things that like I didn't really know about until I started working with like NFL linemen. Is like the level of violence that occurs at that level. Like case in point, like we had a guy. I mean, some of the injuries are crazy, right? But there was a dude from the defensive end for the Lions that had a
Aiden Hutchinson,
yeah. You look at that, right? And
because he had a tib fib break, right?
yeah. So essentially, like his legs whipping around, and you see like his shin bone just wrap around a nut, right? And so this is the forces that are getting transmitted at that level where it can shatter. So put everything that you guys said, and then put that into like you're just talking about the forces that you can generate. But what happens when I'm going to try to generate force through you?
Yeah.
Mm-hmm.
You see what I'm saying? Where you're a hockey player and think about, you guys ever go to like the Blue Jackets game?
Yeah.
Oh yeah. I mean, they get into it.
Yeah, and you can see how fast they're moving on the ice.
Mm-hmm.
So when they go to stop, to your point, if they can't feel that and their nervous system starts to generate force into that tissue, you're going to run into a real big issue, which I do believe that, the NHL has been dealing with some adductor issues, and there's some specific nuances to that that are probably down a rabbit hole. But yeah, that's what you see as kind of like a main rate limiter is this connective tissue. And then to your point, right, like it just, the symptomology of it gets treated, but it doesn't get scaled up.
Right.
And there's no corrective intervention for it. Yeah.
So and I think the other thing that people want to make it clear is I think a lot of people will say, well, is that what physical therapy does? Like if I go to my physical therapist, is that FRS?
Yeah, depends. Yeah. So with yeah, yes and no, right? Like FRS is has been, highly successful and integrated, in a lot of places, right? But unfortunately, just because people take the seminar doesn't mean that maybe they technically incorporate it, right? So it kind of depends because like physical therapy, I see a lot of people that physical therapy, you guys probably too, didn't work,
Mm-hmm.
right? Like I get a lot of people where it's like, I'm shit out of luck, and like I'm here not by choice. I'm here because like these conventional methods have failed me.
Yep.
Right. And so once again, so like this is kind of, I'll just kind of term it this way. This is what I see from my perspective when I do like an intake, and I'm like, okay, like you have, this type of, let's say, a grade 2 strain, right? And you go, okay, well, what are you doing specifically for this tissue? And then they give you an exercise, and you go, okay, you're doing a corrective exercise, and that's not what's needed. Like what's needed is like specific work that's going to scale up this tissue. So the two, you're trying to put like a round hole in a square peg, right? You see what I'm saying? Where it's kind of like, listen, like I wanted you to tell me what you're doing for this tissue, and instead you just said, well, I'm squatting. And it's like, oh, that's great. but like you probably don't have the prerequisite to squat.
Right.
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 You see what I'm saying? So
So this technique is a specific technique that has been developed over time that just focuses on strengthening connective tissues
well,
and increasing range of motion of those tissues at the same time. Is that correct? Or
yeah. So originally, and I don't want to speak for Dr. Spina, right? But so essentially, so how it emerged, right? How this system came out is essentially the background was chiropractic. Okay, so essentially he was a chiropractor, and then they started doing like palpation, and through palpation. So initially, the first courses were palpation-based courses, and then it started off with essentially what's called FR, which is like the soft tissue component of how you would treat that. And then from FR, then came FRC, which was at a point in time supposed to be like if you go to the course, it's like how like you're kind of done with therapy, and they're like, okay, well off you go back to performance. This was supposed to be like, hey, the gap between there. But then what ended up happening is that continued to scale up, and it was like, okay, well, when you think about functional range systems, right? Essentially, you're going to think about what's called controlled articular rotations and PALs and rails. Those are going to be like the really big components. And so, what a controlled articular rotation is, like we're discussing exercises. So think of a controlled articular rotation as a movement where you take your joint through its in a controlled manner through its outermost rotational range of motion. And the reason why you're doing that is because there's a lot of reasons. Predominantly, it's health reasons at first. Like, listen, like I just want you to start to move your joint through its outermost range of motion, pain-free range of motion. And then what that does is that starts to get you better at controlling your joint. So that's why, like, when we teach seminars, we wear shirts, control yourself. Hey, you're just getting better at controlling yourself, right? And that's a very effective mechanism of training, right? And then what ends up happening is, and then it becomes tissue specific, where it's like, what a PALS is and a rails is it's an isometric, but it's at a specific length. So you can do isometric at any range of motion. The progressive isometric is going to be at tissue length. And when you do an isometric at tissue length, due to the biological law of specificity, you get more length. And if you're getting more length in a joint capsule, you get more range. It opens up more access to the joint. And so you can start to see. And then the regressive side is the short side. And so you train progressive and you train regressive so that the nervous system can control both sides of whatever new range of motion you come up with. Right. And so that's kind of where we kind of see a fork in the road of like, well, what's the difference between flexibility and mobility? And that's kind of where Dr. Spina really was like, made people question like, okay, well, flexibility means that like I can take your joint to its passive range of motion, but you may not be able to exhibit any neurological control there. And that's kind of where that came out of, right? And then an assessment course followed for how to do specific assessments to then be able to like figure out what to do with these joints or tissues or whatever. And then from that, like it had been building, we had so many people in high performance that are like, okay, like, but there's got to be like more. And that's where, then the ISM is kind of like, okay, the ISM is how it's kind of like Dewey Nielsen, who's one of the instructors. He kind of says like, the ISM kind of teaches everybody what they want, if that makes sense, right?
Yep.
But before you get to what you want, you have to kind of have this prerequisite knowledge of like I just said, like, this flow chart.
Yeah. And it's interesting when he talks about like even starting with controlled articular rotations. I had surgery on both my shoulders in high school, right? And when we were working in our last office together, I had unknowingly started to develop some mild like posterior adhesive capsulitis in both my shoulders, where anytime I pressed with a bar, I was like debilitated for 3 weeks. And I talked to John a little bit, and he's like, we'll do this. He took me through some range of motions with my shoulder. And this is something I see in patients all the time now with nagging shoulder injuries, is when I would go to abduct my shoulder, like to do a lateral raise for something, wouldn't move my shoulder at all. I'd elevate my scapula. So like the range of motion that I actually had from a shoulder joint standpoint was almost non-existent. In fact, most of the time that I thought I was moving my shoulder, I wasn't actually moving my shoulder at all. So there was a disassociation between what moving my shoulder was versus what I thought it was. And just working with John in like 2 weeks of, hey, this is identifying like what's actually your shoulder, like what's actually your shoulder girdle versus what's actually the joint. Which one are you moving? Identify which one you're moving. Same thing goes for hip and back. And then this is how you, and when he's talking about loading tissue at end range, he's talking about end range of the connective tissue, the capsular tissue, like let's identify your end ranges. This is how you movement. This is 10 years ago, and now I can press all the time, have great range, and I'm pain free, right?
Mm-hmm.
Same thing with my back, where John talked about PT. I have a fused lumbar spine. I had my spine fused when I was 22. Well, after that surgery, once a year for probably the next 10 years, I'd work out, but then I'd sneeze or something and throw my back out, right? Well, the reason I had the fusion in the first place was because my discs went bad. They went bad because I didn't articulate those joints, right? And then the concern with the fusion is the levels above it then go bad. Everything I did in PT was static isometric muscular training. Do a plank, do a row, and don't let your back move. Do this and don't let your back move. And John's like, well, yeah, you haven't trained for spine movement. You've done nothing to load the connective tissue around the spine, to articulate, to move, to absorb load. So think about when you always hurt yourself. Like in a perfectly controlled environment, you could go pick up 400 pounds because you can control your spine in a static or an isometric fashion, but you sneeze and you're laid up for 3 weeks because you did something quick and violent that tissue has never been trained to handle.
Mm-hmm.
And that's where PT fell short for me.
Mm-hmm. Yeah. It's always that's so like the first question that you give, it's funny. It's kind of like it gets brought up because somebody's injured.
Mm-hmm.
Do you know what I mean? So it's like it's kind of never in your line of vision until like it's acute and in your line of vision,
Right.
and then you're like, well, what do I do about this now, right? And there's kind of two pathways, right? One, treating the symptomology, maybe doing corrective exercise, right? And then the other pathway is like, hey, this stuff's trainable. Let's start to see where this tissue's at and what we can do with it.
And so when you're talking about training the tissue,
Yeah.
it's just like movements that they're doing, like they're trying to put their mind into, because I mean, we hear about like, I always focus on the muscle that I'm trying to build, right? When I'm working out.
Yeah, for sure.
So now walk me through like if I had like something wrong with my hip or my shoulder. So I'm trying to put my mind into my joint.
Yeah. Okay. Yeah. This is. Yeah. I don't know if you wanted to open this up, but we'll go down it. So this is a really good question. Okay. So essentially, if you look at exercise science, everybody's convergently agreed that the mechanism that stimulates adaptation is intensity.
Mm-hmm.
Does that make sense?
Yeah.
Right. And then intensity is also kind of like this word that people use in a very broad, general manner. Does this make sense? And this kind of gets us into trouble because we have the biological law of specificity that says that how you train your bicep is going to be very specific to what you get.
Mm-hmm.
Right. So like, if you don't do supinated stuff, you may not build a peak. This is because of the specificity of how that load is.
Mm-hmm.
Okay. So what we had to do is we had to figure out a way to create a system that constrains intensity to give us what we want for that tissue, which is technically the ISM. And so one of those components is intent. So you just told me what your intent was. You said, listen, like my intent to do this is to build this tissue.
Mm-hmm.
Does that make sense?
Mm-hmm.
Right? Okay. Or let's say just to stimulate that tissue. And so then I would go, well, what do you want to do with that tissue? Do you want it to be the red muscle tissue? Do you want it to be the white tissue? Like, do you want the tissue to scale up in size? Do you want it to scale up in performance? Right. And so now we have kind of like you can see we kind of open up Pandora's box to a degree.
Wait, okay. So you're talking about this, like, so you're saying if I came to you and I'm like, John, I'm trying to grow my glutes. Nothing's going on back there though. And I'm squatting, I'm like spinning, 3 sessions, Monday, Wednesday, Friday. I'm working out so hard. I'm doing all this shit. I mean, I'm literally doing it all. Nothing's going on back there.
Mhm.
right? I still got flat pancakes going on.
Okay.
So tell me,
Yeah.
can you break
been
it
talking to my
apart
wife
like
too
we're
much.
talking about?
Yeah, there you go.
Is
Yeah.
that what you're saying?
Yeah, for sure. So essentially what we're saying, okay, not to get too crazy, but like one of the things that we kind of had to discuss is the difference between propagating work and non-propagating work.
Mm-hmm.
So anytime when you look at training, because what you're doing is training, what we did is we used Peters Atkins definition of what work is. And what work is the constrained release of energy into a few degrees of freedom. The degrees of freedom that you're discussing right now is your glutes.
Mm-hmm.
Like we want right, because like if you want to scale that stuff up, right,
Mhm.
you're going to have to spend energy, right? Like there's a cost to that.
Mm-hmm.
Does that make sense?
Yeah.
And then remember we were talking about like the biological law of specificity, where it's like, I think Todd Hargrove has a really good example of biological law of specificity, where he discusses Lance Armstrong built his VO2 max up cycling, right? And then he goes to run a marathon and he does horrible
Yeah.
because he built his VO2 max up on
On a bike, not
on a
running.
bike. Exactly. Okay.
Yeah.
So that's a real life example of like, listen, like that's how specific this stuff is, right?
Wow.
So so let's get back to propagating work, non-propagating work, right? So I try to explain this to people. So just because you're doing work doesn't mean like think about it. In the case that you're discussing, you're doing work, and I'm not talking about you, but I'm just talking about the case, right? But
Yeah.
but like you're doing work and you're like, listen, I'm trying to like build my glutes, but it looks like a pancake still. But you're still doing work.
Yeah.
You see what I'm saying?
Mhm.
So that's non-propagating work. That means you're doing work, but it's not achieving the outcome that you want. The simple example that I give, right? When I'm married, right? And so, I tell people the simple example, we have these TVs in the house now. Hey, I want this TV in the garage where we work out. So I get the TV from one of the rooms. I bring it down into the garage. My wife goes, no, I don't want it there anymore. I did work, but it's non-propagating.
Yeah.
You see what I'm saying?
Right.
Yeah.
Okay, so I did work. Like I used energy. I had to take that TV off. I walked it all the way up the stairs. Like my intent was to make her happy. It didn't. That's not how it worked out. You see what I'm saying? So
Right.
you can have the intent you want, but if the other things that are constraining it don't line up, like you're doing work, but it's non-propagating.
Mm-hmm.
Okay, and so one of the things that we discussed is, hey, well, there's an intent to training, right? And that's what you're describing. So then what we have to do is we have to give your intent to match up with your effort, to match up with the load.
Mm-hmm.
And so essentially we did, in the ISM, I always tell people like it's a lot of work, but we already did it for you. So in your case, we would say, okay, you're talking about you want your glutes, which is a muscle. So that's red muscle tissue. So you want that red muscle tissue to scale up,
Mm-hmm.
right?
Mhm.
So that's the intent. So then we would select a position for you to get in there. The position doesn't matter per se, right? You can do, we would say like, well, when you train your glutes, what do you get the best contraction in? Do you have an exercise that comes to mind where you're like, man, like my glutes, like I can, like a glute donkey kickback. I don't know.
I like
Lunge.
the 45-degree hyper, like,
Okay.
yeah,
45-degree hyper.
with some weight.
Yeah. With some weight, with
Yeah.
some more load. Okay. Perfect. So you're like, this is what I get the best contraction in. Okay. So now we have the position that we're going to put you in.
Mm-hmm.
We have the training intent. Now we just have to get the load and the effort to also line up. So what would that load be? Well, you want to build more tissue. So if you want to build more tissue, your nervous system has to call upon and use that tissue to do work until you reach near failure or failure.
Mm-hmm.
Well, why is that? Because if your nervous system is trying to output, so you have the intent, I'm trying to do more of this back extension, but I can't do it anymore. Now what starts to happen, and I won't get into the specifics of this, right? But essentially now your nervous system is going, there's not enough tissue there. There's not enough tissue there,
Mm-hmm.
right? And now you start to do that exercise, right? So now that's a stimulating intensity to say, grow more tissue there.
Mm-hmm.
And if you do all the stuff that you need that is outside of the gym, which is, your nutrition, your rest, your recovery, all that stuff, right? Then what'll happen the next time is your glutes are going to think, hey, the same stressor is coming again in the future, but now I have more tissue to do more work.
Mm-hmm.
Okay.
Makes sense.
So it's a very kind of, it's like a long drawn out chain of logic, but you can do that.
So you're doing the same thing with tendons and ligaments.
100%.
Mm-hmm.
It's just the load's going to be different. And so like in your case, and so we came up with like new things where, you know, people talk about time under tension. Have you heard of this concept by chance?
No, go ahead.
TUT.
Yeah.
Like everyone's like, oh, TUT. It's not.
So,
It's
because the
not
way
as
the
important.
way you make a tendon stronger is different than the way you make a muscle stronger.
Correct, because if not, they would do the same thing.
Right. Okay. So explain the difference there. So because the solution to my knee pain, my tendinopathy, isn't to squat more.
Correct.
So
like,
to do 3 reps on a squat, because that might make my quad bigger, but it's going to be counterproductive to this. So
100%.
okay.
Yeah. And so like in her case, like the setup that we just went through, that was for
It's for muscle.
Yeah, that was for her glutes.
So let's say now she has patella tendonitis.
Yeah. So one of the things with red muscle tissue, right? Like you have actin and myosin, and they talk about like the sliding muscle, the sliding filament theory,
Yep.
right? Okay, where it's like muscles slide across. That's how you move,
Mhm.
right? Is they slide across. So when you're training muscle, you want constant tension, and they have to slide.
Yeah.
Mhm. Yeah.
That's why you're doing reps, and then we would say like, hey, if you want more of a stimulus, instead of doing just a conventional exercise, we would have you do what's called a continuous tension set. So we would just, instead of looking at the movement, we would look at the glute tissue, and we would maybe divide it up into 3 categories, and we'd be like, do small reps here until you reach near failure, do small reps here, and then do small reps here, so that the entire tissue has been trained appropriately. And you don't just generate force in one part, and so that force is funneling through all of that. Work is being done in all that tissue.
Mhm.
So you don't get maybe like a pancake on one side.
Right.
You get like, you see what I'm saying?
Yeah.
Right. So, does this make sense?
Yeah.
Sure.
Okay. So with connective tissue, you would take the tissue, like length is a stimulus. So, we discussed load, effort, and intent, and then there's load. Well, length is a load for connective tissue. So connective tissue, when you're trying to create more of it, you need to take it to length.
Gotcha. Okay.
Mhm.
Does that make
Or
sense?
stretch.
Yeah. And that stretch is the connective tissue getting loaded,
Mm-hmm.
right? But that's not going to train the muscle tissue. Because remember, the muscle tissue has to do this.
Mhm. Yeah.
You see what I'm saying?
That's why people don't like to stretch, because you can't see it.
Yeah. Yeah.
Well, I
I
don't
do bicep
stretch just
curls
because
when-
I'm like in a hurry. I'm lazy. I'm being serious. I mean, how
Well, people
many?
have finite amount
hurry.
of time, so
Yeah, like
if you're going to
I'm-
go to the gym, if you curl for 30 minutes, at least I'm going to get a pump. If I stretch my elbow, that's pretty boring, right? But even though it's necessary long term,
yeah,
but it's just you don't get the same like the same visual benefit, maybe, or whatever.
Well, and it's the feeling of lengthening connective tissue is such a weird sensation. I never felt it until I worked with John when I was working on my shoulder and then working on my hip to preserve my back. Like, hey, we're gonna feel heel, and you're gonna feel this. You feel tension deep in the joint, but there's almost no muscular tension at all, and that's a very weird sensation when you feel it. When you feel your connective tissue activate in the capsule, because you're like, this hurts like hell, and it's really hard, but there's no tension in my muscle whatsoever.
Mhm.
He's like, yeah, that's your hip capsule. Now your connective tissue is being stimulated. It's a very bizarre.
So really,
sensation.
with this, if you're feeling the muscle, you're probably not doing the technique right.
Yeah, for sure. Because you want the load, right? We're talking about load. We're talking about like a lot of different topics, right?
Right.
But yeah, like what he's describing is he's now describing that this load, which is this external concept, is now we're looking at it from the inside out. Now he's describing where the load is. So now he's giving me feedback that tissue is getting loaded where I want it at. And now that load, I know that load is doing work. Why? Because the connective tissue is at length. And length is one stimulus that you can do. So in load, you can train, you can be at length, you can go to length, or you can go to length at optimal velocity. Or you can do oscillatory. There's all sorts of different, it's kind of like, there's almost so much
Right.
that you can do, right? But essentially what he's describing is now how the load is in the white connective tissue, and he's getting stimulating training effects, which is what he needs. But, people like you're saying, right? Like there's a difference between what you need and what you want.
Mhm.
And most people, like I said, that's why the question that you gave is so good. Most people don't discuss this until they're like, now I want to do this back extension to train my glutes, and I can't.
right.
And now it's like,
Yeah.
oh, well, now you have to start to now look at maybe a joint. You have to look at connective tissue. and things that, you know, if we're honest about, really aren't nearly as fun to train.
Right. Is it fair to say too, if you don't do something like this over time, your joints will continue to contract and contract and contract? Is that correct?
Yeah, because the connective tissue is biological stress responsive tissue, right? So if you stop stressing it, it's going to essentially, instead of scaling up, it'll start to scale down.
Mm-hmm.
Right. So it's like we live in a very dynamic world, right? So it's like, and the tissue is the same way. So just like, you know, in the case that we discussed where her tissue is starting to scale up, why is it scaling up? Because she's loading that tissue in a very specific manner, and that tissue is going, hey, I think this same stressor is going to come again in the future, but nature always makes the prediction it's going to be a little bit worse.
Mm-hmm.
That's how then she can start to go, well, when I first was using, you know, I was using 30-pound barbell. Now I can use a 40-pound barbell. Right. Well, yeah, because there's more tissue.
Yep.
This kind of makes sense.
100%.
And in regards to the specific question that you asked, right, because the joint space is encapsulated by white connective tissue, that tissue is always remodeling. And if you're not taking that connective tissue to length, you're going to get the exact opposite of length.
Short. Yep.
Mm-hmm.
And then you lose joint space.
Yeah. And now you're talking about, okay, now that really dense white connective tissue that we want it to have these behaviors of elasticity and stress stiffening, and we want it to behave in a very specific way. It's just there. It's just shit tissue, honestly.
Yeah.
You know what I mean? Where it's like, you know, you take someone's joint to end range of motion. It's kind of funny, and they're like, well, I don't feel anything. It's like, well, this is a huge issue. Like,
Yeah.
like I'm at your end range of the joint, and you don't feel anything. So like, what's stopping this thing? Well, I don't know. Yeah, me neither. But it's probably that back injury.
Right.
Yeah.
So
Wow.
so how does this? So you know, obviously we do a lot of joint. We treat a lot of people with joint pain here. You know, and obviously we try to do like regenerative procedures like PRP, A2M, stem cells, different things like that, which is great to help the tissue become more healthy. But if you don't do FRC with it or FRS, you're still leaving stuff on the table because you can help heal that tissue, but if you go back to the cardinal problem, it's not strong, or it's you're not conditioning it, you're going to end up with the same problem downstream probably.
Yeah, 100%. Yeah, and that's why, like, kind of, I think, you know, you guys are kind of on the edge of it where you're kind of combining both pathways. You know what I mean? Like, so it's like, you know, you're going to get, you know, if you do one thing, you know, like even if you do the loading, yeah, you're going to get great response to that. But if you can have other things that help those tissues regenerate, like, well, now guess what? Maybe the tissue regenerates faster. Now it's scaling up. Now you can get more loading. Now that you can get more, and now you're actually like, you know, pushing this ball in the direction that you want, right? And so like the two, you know, they pair very, very well, as you guys know, that's right. But yeah,
it's kind of
for
we're giving it the nutrition. It's kind of like the bodybuilder. We're giving you the protein and the hormones. We still got to go train.
Yeah.
So the
You
same
still-
thing with joint rejuvenation. We're giving you know peptides, PRP, whatever. But if you don't go back and train that, you're probably gonna end up back in the same place.
Correct. Yeah, for sure.
Yeah.
That's really well put.
So then how long do people spend, like, you know, on this stuff, like, per week? Like, they just do it at their own pace? Like, you know what I mean? They're not going anywhere for this. They're doing it in their home,
Mm-hmm.
right?
Yeah, for sure. Yeah, so it's a great question. So that's why, like, a lot of this is just trying to teach people. Like, I always tell people, like, because, you know, you guys probably get a lot of what I get, where it's kind of like, hey, you know, this is a Hail Mary. I'm not here. You weren't my first choice. You're my
Yeah, we're last. We're last.
right, right, like, which is fine, right? But, you know, so you have to teach them how to manage this issue.
Mhm.
See, I always tell people that there's like a huge educational barrier. So I think that it's more important that we educate them on like what their joint is, so that they know the difference between, you know, training your joint and then using your joint to do a bench press.
Mm-hmm.
Okay.
Yeah.
And now listen, why don't you just pair the two? So you're talking about pairing the two. Well, you love, you know, doing the glute raise. Well, just do a hip joint car when you do it. Right. And then they're like, oh, okay. But, you know, it's kind of funny. Like I said, my background's at Westside, you know, Westside on their dynamic effort days, you know, they do a lot of sets. It's where they take a barbell and they use a submaximal load. They try to move it as fast as they can. So we'll do like 9-10 sets, right? It's significantly more than, you know, I think you technically need.
Right.
Right. And so I'll just tell them, well, every time you do a set, just do a shoulder joint car. They're like, that's a lot of volume.
Yeah.
And I'm like, well, you're the one that selected. And so like I try to bring up these conversation pieces where they're like, okay, well, you showed me how to do this joint car. When do I do it? So listen, every set that you do on a bench press, just do me a favor and do a shoulder joint car. And immediately they're like, and I'm like, listen, man, I'm just saying that you should be at a 1-to-1 ratio.
Right.
Like you're here because you have a joint issue. You see
Right.
what I'm saying?
Mhm.
Okay. So to kind of answer your question, there's things that you can do to preserve joint space that are very minimal that like really don't add any time. Does that make sense?
Yeah.
So you could do it in between your sets.
Yeah. So, and that's what I was
Okay.
going to say. Like,
Yeah, that's cool.
you would say that the input to get what you need out of connective tissue adaptation, it takes significantly lesser time than it would necessarily train a muscle.
Yeah. Yeah, for sure. Yeah, for sure. So one of the funny things too is, right, like if you look at the literature, right? I was telling one of my colleagues this, man. Like I hope we'll see. But you know, so we're doing all this research on connective tissue, and there's this thing called sarcomerogenesis.
Yep.
So you have a sarcomere, and a sarcomere is just that's where the actin and myosin are. So the cross bridges,
Yep.
right? Okay. And you know how they're like, well, like you can't create. Remember when I was in school, they were like, listen, sarcomerogenesis, you can't elicit it.
Right.
Right. Well, now that's been proven to be
Moving wrong.
wrong. Well, how do you elicit it? You elicit it by eliciting adaptation in the connective tissue. So when you create more length in the connective tissue, you create space. And now that space is where protein can get filled if you're doing it actively.
Yep.
Okay. This is kind of revolutionary, right?
Right.
And they've also linked it up where your fascicle length is an indicator for whether or not you can get injured. So we have organizations right now that are really interested in the length, the fascicle lengths in the adductor and the hamstring, because it's not a coincidence that the fastest individuals in the world have the longest fascicles in the hamstring, and they also are least likely to get injured. Because think about it, if you're laying down new connective tissue architecture, and that connective tissue architecture has muscle in it, now you have new length to go into, but now you have control over it because the red stuff is hooked up to the nervous system. And so now you have more control at length. If you have more control at length, now you can generate more force at length. Right?
Makes sense.
This
Yep.
is kind of
Yeah, it makes sense.
right. And so this is kind of how I conceptually think about it. You know, if you have a functioning joint, it's very easy to sustain joint function because all functioning joints behave the same. So we go, listen, just do some cars. Maybe we do different variations of cars, right? So we're talking about like your hip car. Maybe you do it standing, and then we'll go, hey, we'll teach you how to do it side lying, just so there's a little bit of variation. You know, does this make sense?
Yep.
All right. Now, if you have a dysfunctional joint, all dysfunctional joints behave differently based off of their level of dysfunction.
Right.
And this is where you need to have, you know, like look at like World War I, World War II, right? They're just bombing shit. So you're just praying that it hits the target.
Yeah.
Right. Listen, we want precision guided bombing. Right. Yeah. So that's kind of why that assessment is so important, because it's like your joint is dysfunctional because this tissue isn't behaving how we want. So now what we have to do for this individual is we have to find a position where the load goes into that white tissue, what he's describing, and then that load, and then we're going to have the intent to get more length into it, right?
Right.
And then maybe we go, well, hey, we want you to put muscular effort into that. So then that white stuff that's at length starts to get pulled aggressively more at length. And now you're really stimulating that tissue.
And that's how you get white tissue to grow
Yeah.
or become stronger.
Yeah. And that's why if you look at bodybuilding right now, right, which, you know, they're kind of really slow moving, but that's why like now they're saying like if you want to build your glutes, probably the reason why you selected that is because you feel a nice stretch in your glutes, and that stretch propagates into your nervous system to go use that stuff to then go the opposite way because you're getting that stretch.
Yep.
Does that make sense? If you're doing movements where there's no stretch, you're not getting that stimulus into the connective tissue. That's why the majority of time when you talk to athletes who have like a really good physique built, and you go, well, hey, what are you doing for, you know, whatever this, what are you doing for your hamstrings? They're always selected. Well, I do RDLs. When I do RDLs, I throw the barbell away so I get this huge stretch in my hamstring, and then I use my hamstring to come back up.
Mhm.
Right. So you can kind of see how they all interplay with each other, and then you can kind of like pick out which one you want to go with, right? But to get back to that specific question, it's like, you know, there's no downside to not doing a controlled articular rotation, because that individual is getting more control over what the hip does. And so, like, how would that scale to your scenario? So, like, you want to build the glute, but the glute moves the hip. So if your nervous system, like you may conceptually know what your hip is, it's a ball and socket joint, but that doesn't mean that the central nervous system actually really knows what the hip is.
Yeah.
So when you start to take the hip through its anatomical space, it starts to map in the nervous system, and the nervous system goes, oh, like, I have all this space that now I can start to control. And so now you're getting better at controlling your hip. Well, if you can control your hip better, you can contract your glute better. Okay. Okay. You see this chain of logic, right? So then what ends up happening is, because this is what I see all the time, glutes, but also rear delt. You know, rear delt in bodybuilding is like, oh, yeah, can't build my rear delts. Right. Same thing with the pancake ass you're talking about, right? Okay. Right. Okay.
Yeah.
And here's what happens is the reason why you can't do that is because the joint won't let you in there. So this is where we then start to go, well, like, okay, well, that may be a really good exercise to build your glutes, but not for you, because your hip doesn't go into that range.
Right.
So then you're working something else that isn't what's intended.
Correct.
Yeah.
Right. And then you're like, well, I feel a really good low back pump, and I feel it in my hamstrings, but I don't feel it in. And that's when we would just go, well, let's assess the hip. And then we see that the hip isn't doing what it should be doing. Well, there's no exercise that you're going to be able to select. Like, you have to fix that hip. You see what I'm saying? I tell people this all the time, right?
And that's what you're doing. So you work with a lot of athletes because that improves athletic performance then.
Yeah, for sure. And then, you know, like, it's always funny when you're working with like athletes, right? And they're like, well, I don't feel this. We're like, listen, that's on you. Like, that's a you issue. Because then people will be like, oh, well, let's adjust them. I'm like, hold on. Wait, you're telling me you don't feel any length in your hamstring? Yeah, listen, you got a hip issue. You see,
right?
You see it? Because then they go, well, oh, there's an issue with this. No. There's not an issue with that. There's an issue with you and this. And so what we have to do is we have to scale up your capacity so that you meet the demands better. And so that's essentially, it's a very sad thing that I see all the time where, you know, like, let's say, you know, in physique type sports, someone's trying to build something, but they don't have a hip. So you could get exercise science to convergently agree that this is the greatest exercise to build the glutes.
Yep.
But not if you got
But if the hip's malfunctioning, it doesn't matter.
Yeah. Wow.
Which is horrible.
Yeah.
It's a horrible position to be in.
And I think what's been good for our practice is then you've come up with protocols, because this is something, like you said, you really don't need to go to a PT. You can do this on your own at home, right?
Yeah.
And it's not a tremendous amount of time. So it's just something you do, 5-10 minutes a day at home.
Yeah, for sure. Yeah. So that's what we did with Brian Fox, right? Like, and so essentially, yeah, you guys were one of the first to really incorporate that, right? Where it's like, you know, you guys have the science down on all this regenerative and how to sequence that over time, right? And so essentially, yeah, what we did was we all functioning joints behave the same. So, like, you know, hip joint has to rotate.
Right.
So we just build in these like fundamental things that all joints should have. Right. And because we're doing internal training, which is training that isn't to get better at like a squat, we're doing training that's joint specific. That's why you termed it like joint specific training. It's exactly what it is. So we're training to try to increase length into the capsule. And we're training to then also get better at the nervous system, learning how to control that anatomy. And when you start to, and so that takes, when you're very specific and you go, hey, this is the joint that we want to target, like you guys said, right? Then we can just build that protocol, and then boom, you kind of have it, because once again, all functioning joints behave the same way. So we're just building in those elements of function. And you don't, and one of the things with this type of training of connective tissue, it's not like training your nervous system or your muscle tissue. This is where people kind of get the intensity stuff skewed.
Yeah.
What's a stimulating intensity for your nervous system is not stimulating for your connective tissue.
Mm-hmm. That makes sense.
Mhm.
Okay. And I love it too. I love to stimulate my nervous system too much.
Yeah.
Right. That makes sense.
Okay. And that's what people love. I love to go to the gym. I love to get my
Well,
nervous.
especially your athletes. Your athletes think more pain better.
Right.
If it's not hurting, it's not doing anything. I don't really feel this,
Exactly.
but it doesn't work that way.
Mhm.
Exactly. And so like, you know, when you're doing all this high effort, high output stuff, that's great to build muscle tissue and to build your nervous system up, but your joints need the inverse,
Yep.
Yeah.
right? That's why it's kind of tedious.
Yep.
Okay.
Yeah.
Okay. But because it's not such a high load onto your nervous system, you can do it with higher frequency.
Mhm.
Mm-hmm.
Okay. Does this make sense?
Yeah.
Yeah.
Right?
So what would you say? So someone say they have a shoulder problem, and they have shoulder arthritis. We do A2M on it, get the proteases out of there, put some stem cells or PRP in there to help with regeneration. But the shoulder capsule's still very contracted. That's something we see all the time.
Mhm.
How much time, if you said per day, hey Buzz, what's the effort you're gonna have to put in to get this capsule back, and how much time?
Yeah. So
Ballpark. I know it's a loaded question. but-
yeah, no. So essentially, like the protocols that we ended up doing for you guys is essentially they last about anywhere from 10 to 15 minutes. It's technically for both joints
Mhm.
because we're so specific that it doesn't take a lot of time. And then we would say like, hey, you can do that at a frequency of a minimum of maybe 2 to 3 times per week. But if you feel good, you can keep doing it because it's connective tissue.
You're not
in
going
the
to
joint.
overtrain it. You're not going to overdo it.
Yeah, you don't worry about pushing the nervous system too hard. Those are constraints that you have to worry about. Is nervous system can only output so high in certain scenarios.
Like weight training, you can't weight train 3 hours a day. Obviously, it's
Yeah.
too much. But this doesn't work that way.
Yeah,
Yeah.
for sure.
Wow.
So at the end of the day, if someone's got joint problems, which the majority of people's problems are joint, not muscle,
Right.
Yeah,
This
Yeah.
is
so don't bitch
This
about
is-
it if you're not going to do anything
Yeah.
to
and this
to
is what they
strengthen it.
need, right?
yeah, for sure.
Okay. Cool.
Yeah.
John. Wow. I learned a lot today.
That's
I'm
good.
telling you, I'm gonna be looking for you for these hips.
Mm-hmm.
Yeah. I need to do some work on these bad boys because I know they're jacked up. So, anything else you want to share?
No, just I appreciate the conversation. And,
Yeah, me too.
yeah, and like
Because I totally
That was
thought it
helpful
was
too.
about.
I will tell you, people will ask me because other doctors what we do, and I'll say FRF or FRS or FRC, and then you look online. There's really nothing good online. Like I think Peter Alta has like a girl on there one time, but I don't think she did a real good job of explaining it. So it's hard to articulate. So I think you did a really good job today.
Yeah, you did. And I'm excited for people because, I like working out and I want my muscles to grow. I want them to be doing something. I go every day to the gym. So if you go every day to the gym and you work out really hard and nothing's happening, right?
Mhm,
And maybe it's the joint
mhm,
that you need to work on, right? The connective tissue,
for sure.
which is like mind blowing to me right now. You're blowing my mind. So I love that. But not only that, but a lot of people need to work. We always get calls about people's joints. They hurt, right?
Mhm.
And a lot of people don't think to exercise their joints. So this was great. This was good stuff. I like it.
Yeah.
And I'm excited too, because I'll be right now, if we take the pancake and we grow it into something, all because of my hip, I'll be your biggest fan. So, all right. So that's it for today. John, thank you for being part of the show. We all have to go back to work now. And if you have any questions for us, we'd love to hear from you. Other than that, we'll see you next time.